Welcome to All Home Care Matters, the show where we discuss all things home care, with discussions on important age-related matters and topics. Brought to you by Enriched Life Home Care Services, the #1 rated home care provider in Michigan by Top Rated Local.
Hello, and welcome back to All Home Care Matters. If this is your first time visiting us here at the show, we want to say thank you for taking time out to be with us today. We appreciate how valuable everyone's time is, and that's why we try and make each episode here at All Home Care Matters something that will hopefully matter to you. Today, we are honored to welcome a remarkable guest, Dr. Buffy Lloyd-Krejci, the author of the book, Broken. Thank you so much for being with us, Dr. Buffy.
Thanks, Lance, for having me. Glad to be here.
It's our pleasure. So let's start, Dr. Buffy, would you share with our viewers and listeners kind of what your background is?
Sure. Well, I have my doctorate in public health and epidemiology, and really started in healthcare when I was 17 years old. I've always had a passion to help people with their healthcare needs. Worked in hospitals and public health and research, over a very long career, over 25 years of really looking and helping vulnerable populations. I would say in the last decade, really using data to understand the story and then to implement solutions. And that's really where my journey led me into the nursing homes, was a national pilot study that I was doing with the CDC and CMS, supporting nursing homes, entering some infectious disease data into the CDC. And it's really what cracked my world open to seeing the disparities and disproportionate number of infections. And really, for me, it was a call to action.
Right.
And I was captivated to jump in and do something about it.
What is the motivator behind writing your book, Broken?
Well, we've all been through this global pandemic, and I never intended to write a book as I was in the middle of it, working, helping nursing homes, supporting them with their mitigation and control efforts. But what really compelled me, first of all, it was a colleague that encouraged me to, just given what I was seeing and, just really that the public needs this, the healthcare industry needs this. But really what motivated me was seeing and hearing the same exact story, whether I was in Arizona or Texas or Michigan, Idaho. It didn't matter where I was in the country. The story was the same. It was the nursing homes story was the same, and what they needed and the support they needed and the challenges they had. Right. And I really wanted to write this story because I felt like the nursing home, the senior care industry itself is so misunderstood. And, the nursing homes are often very vilified, and, we hear the horrible news, but we don't really hear of what's going on behind the scenes. And I really wanted to shed light on that and to demonstrate and just show a different story of maybe what the public doesn't know.
What did you find during your research and even with writing Broken that the COVID-19 pandemic had really exposed the weaknesses in nursing homes? Because, like you mentioned, we deal with families daily, like yourself, where we're seeing, the struggles they have, the complaints they have, the issues that they have from their side, but also on these, long-term and short-term care facilities, rehab facilities, nursing homes. What did COVID-19 do to really expose those weaknesses? What did you find?
As I write in my book, the problems with infections in nursing homes was long before COVID-19. And it's actually what prompted me to start my own company in 2017, was to get out there and really start helping reduce the infections that were already occurring. And we weren't as a nation doing a whole lot about it. And so it was kind of like under the radar, even in the healthcare industry itself. Well, of course, then COVID hits, and the entire country, the entire world is not prepared for this. And so an industry that already has an estimated 1 to 3 million infections every year, over 1,000 people dying of infections every day, just before COVID, it really showed how unprepared, but also just what a huge problem this has been even before the pandemic, and that we just haven't made it a priority
Mhm.
within this industry to correct. I mean, the 2013 National Action Plan for reducing healthcare associated infections has, hospitals and dialysis centers, outpatient ambulatory centers, and it has long-term care last. So really, even in public health priorities, we've prioritized long-term care last in reducing these disproportionate infections. And so the pandemic really showed how we have neglected this industry and neglected to prioritize them into working on this huge problem.
Do you think it took COVID-19 to bring these issues to light nationally?
We were, as a nation, and I will say like CDC, CMS, the public health, we were slowly getting there. There were new federal CMS rules that began in 2016. But it was only November 28th of 2019, literally months before this worldwide, pandemic hit, that the nursing homes were even required to have somebody working on infection control in their healthcare setting. And so you can just see that we were slowly getting there. I think what COVID did would have taken us another 10 years to get to. So it like threw the industry in the deep end, like ready or not, it's here. And so if there's any silver lining to all of this, it's been that it has exposed this huge need to support this industry and to work on this problem now and not take 10 years to strengthen it.
Sure. Now, you mentioned that you believe that the system is set up to fail. Why do you believe it's set up to fail, and how do they change it for the better?
That's a huge, we could talk all day just
Sure.
about that,
Right.
right? Like I said earlier, we hear about these horrible stories. The system is not set up in a sense to support actually the healthcare workers. When you have the high ratios of staff to patients, you've got maybe one LPN caring for 20 patients.
Right.
Same with the nursing aides, especially overnights when you've got maybe one aide to 20, 30 patients. Number one, you will never have high quality care if we don't take care of our healthcare workers. And one person cannot physically do everything at the highest level and the highest quality that resident needs. And so right there, like we're failing before we even get started by the lack of staff that we have and that we've run on for a long time, for many, many years. There's such a huge turnover in this industry, and there was a lot of turnover before the pandemic. And part of that is just the healthcare workers get so burned out
Right.
because they're working under such high demands that it's just not physically possible. You can be the very, very best nurse, very, very best aide, but it's physically, emotionally, mentally impossible to do what's asked. And so at some point you break and you have to move on. That's one situation. And I talk in my book about, a lot. I had no plans on writing 3 chapters about the regulatory system that we have in place that is broken in itself. We need regulations. We need to implement regulations, but the way that system is working, even also short-staffed, undertrained, and so it becomes this nitpicky. If there's funding for more surveys, then it becomes motivated to hand out citations instead of really collaborating, working directly with the facilities and seeing how we can create long-term sustaining changes versus, just citations and penalizing. And
Right.
it's not long-term. It doesn't affect long-term change.
Absolutely. Now, with your work and your business, do you travel consistently around the country? Have you found any similarities, or have you found any stark differences between facilities depending on what region of the country you're in?
There,
Does it
it all
change?
depends. It all
Okay.
depends. I, for a while, I asked that question too to people like, do you see nonprofits versus profits, profitable nursing homes? Many times I'll find maybe the nonprofits, because they're putting everything back into the facility. They may operate differently, but honestly, it can go either way. I've seen both for-profit and nonprofit facilities functioning at the different levels. For me, what I've seen is the facilities that have consistent, long-standing staff and leadership are the ones that appear to be the most successful. When you have strong, solid leadership, then you have strong, solid workforce. It always, for me, I can tell it's all at the leadership level. And when I hear of a DON or an administrator that's been at a facility for 10, 15, 20 years, they're doing a really good job. And I mean,
Right.
because they're so ingrained in their community, and it's a big difference. But of course, then that means they're taking really good care of their staff. They're prioritizing. There's just a different feel, versus maybe a corporate structure where the leadership the corporate or owners may never even go into the building. So,
Well, do you
I
think
think
too, yeah, just to jump in, Dr. Buffy, do you think with ownership that it's beneficial that there's somebody in ownership that has a healthcare background? Because, anybody could get together with a group of investors and, purchase a facility, and usually it's purchased with a business model in mind, right? The bottom line. So they are going to understaff sometimes, and the pay structure might not be as beneficial, but they also don't have that knowledge or that firsthand experience to really understand how the system, if you will, operates. Do you find it more beneficial when the ownership has a healthcare background rather than a business background?
I've seen both, but what I would say matters the most
Yeah.
is when the leadership, when they are in the building and they are seeing what's going on. They're talking to the healthcare workers. They're talking to the residents. If they are not involved at that level, then it purely is a business model, and it's numbers, right?
Right.
But when you're inside and you're talking to the housekeeper and the staff and really coming at it from a human centered, patient centered perspective, it's not just about the dollars. We need, and that's kind of the problem with healthcare in general, even our hospitals and whatnot. It's just it's so run by business. It's so business structure now. We've taken the human element out of
Right.
all of it. And there is great harm. And our nurses feel it. I was just reading an article on LinkedIn about that. The nurses, the typical career span of a bedside nurse is 5 years, because they just can't take it, with the high ratios, staffing ratios. So in general, that's kind of a problem. I think what's important to remember, especially long-term care, is really unique, and people that work in long-term care and have dedicated their career to it, they love this population. They love the
Right.
residents. They care about the seniors. They care about ensuring they have the dignity and respect to live out their days, and their heart is so in it. It's a calling. It's a passion. It's not just for the money. And so when they're not able to fully embrace that and deliver the high quality care that is in their heart to do so, it breaks them. It breaks their spirit, and then they can't continue, because it's doing them harm as well.
Right. We hire, a lot of CNAs and medical assistants, home health aides, what have you. And for a majority, a lot of them are coming from the long-term care setting. And when asked, well, why are you wanting to go into more of a one-on-one setting? That's the exact reason why. They said, I went into this profession because I wanted to help and care for people.
Right.
And I feel I'm more of a factory worker on an assembly line. I'm going from room to room, and sometimes I don't even get to the end of my line because we're so understaffed and because I can't, answer three call lights at one time. And
Right.
I can't do that to these people. And I feel like I'm failing. They're feeling like they're failures because they're being asked to perform the impossible. And,
Right.
they're in a really tough position, which lowers the morale, which then lowers the quality of care. And it's a horrible cycle. And, I think the name of the book, Broken, speaks volumes to really summarizing what we're faced with in this country with the long-term care industry.
Yeah, and it actually causes trauma to that healthcare worker as well
Right.
because they know. I mean, it caused me a lot of trauma to be in the height of the pandemic, to see what was occurring and to be powerless, to not be able to just to see what the healthcare workers were going through, and to see the lack of support they had, and to see the punitive licensing agency handing out citations when they were at their darkest hour. That is just, it's unethical, and it causes harm. And so, and that's again the motivation I wrote, I for writing Broken. And it was actually a very difficult book to write because it describes, it's through interviews, and it describes people's
Yeah.
experiences, it describes my experience. And so on the patient side, and this is why I want so much the public to understand, is the nursing homes. We are typically like, I'm never going to go into a nursing home, don't ever put me into a nursing home. Our elders are begging us not to put them in nursing homes. Well, there's a lot of people that need this level of care, so
Right.
let's invest in it. Let's help fix it. Let's invest in the staff and in the workforce. There's just constant Medicare and Medicaid cuts. There's just cuts, 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 and it's going the wrong direction. Like, we need accountable funding. We need funding that we can show goes towards the staff, goes towards the workers, so that we can have high quality care for our residents. We can't have high quality care if we don't invest in the staff. It just won't
Absolutely.
happen.
Absolutely. And one of the questions I wanted to pose to you is, why do you believe infectious diseases have been such a prevailing issue among nursing homes over the past several years, or years in general? And do you have any quotes or any feedback that you've received from healthcare leaders, industry leaders, or families that you want to share?
Yeah, I mean, I write in my book, Dr. Patricia Stone has done a lot of research on this for the last decade. Dr. Namali Stone is working on. I mean, there's just actually a very few industry leaders that are working on this work. And in general, when we talk about healthcare associated infections are a risk, even if you go to the hospitals, right?
Right.
And so long-term care, you're talking about a highly vulnerable population over the age of 65, living in a congregate healthcare setting, multiple comorbidities. So already you have this population that is high risk. And so we have the issues of antibiotic resistance. So we have more multi-drug resistant organisms, these superbugs that our antibiotics aren't working for. Those are easily spread in this communal type of living. You have infectious diseases like C. difficile, which, it's just, again, easily spread. And a lot of it, even up to, 70% of antibiotics are inappropriately, are not necessary. Same for infections. Up to 70% of infections can be prevented, but we haven't really done a good job. It goes back to say we haven't done a great job at implementing infection prevention.
Right.
And it literally starts with our housekeeping services, our environmental services, and how are we cleaning and what products are we using, and are they actually effectively killing the microorganisms that are living on the surfaces. And that's really what I'm passionate about is implementing the prevention. And that's why I go into the different buildings and look at what they're doing and implement these changes.
Well, and with your business, when we previously spoke, you'd shared when you go into a facility, you're not just addressing the director of nursing or the administrator or the nurses or even just the aides. You're actually starting at ground zero. You're starting with dietary, house cleaning, and then working your way up, because it really is a multifaceted step to this prevention. It's not just the hands-on clinical staff, right?
No, I mean, you talk about, for example, even COVID, or we have to have an environmental cleaning process. How are we cleaning the environment? Are we cross-contaminating the environment? I can't tell you how many buildings I go into. Over 50% when I talk to the housekeepers, they're cleaning the restroom first, and then without changing gloves, they're going straight into the resident room and cleaning the resident table where they eat. So they're literally, and we're talking about a shared restroom. So whatever their neighbor, sometimes there's 4 people to one restroom. So, it's just some simple practice like that. That doesn't cost anybody any extra money. I'm not asking anybody to buy any extra equipment. We're talking about shifting the way a practice is done. And so we have to start there. We have to start with ground zero, start with environment of care. And it's so funny you say, like, I don't talk to I'm not necessarily looking for the administrator or the higher level leadership. In fact, sometimes I'll say, I'll have the housekeeping supervisor talk to him. Like, I don't want to talk to the supervisor. I want to talk to the person who's
Right.
cleaning the rooms.
People
And
actually
I'm
on that.
actually doing it, because the supervisor is going to tell me what should be happening, but I want to see what's happening so I can truly help them. You can have the best policies written. I don't care about that. I want to see exactly what's happening so I can help you and coach you and train you to do it the right way to help prevent, this cross-contamination.
A lot of people, and I'm sure you've encountered them as well, when you talk to them about a long-term care facility or a nursing home, there's always this stigma associated with it more times than not. And what are some of the biggest myths and misconceptions that either the media portrays or just that are out there that you would want to destigmatize?
I think that the first thing is that the care is horrible. The care is horrible, and nobody cares. And it's a place where we just dump our loved ones, and the staff are terrible. And basically, like, nobody cares. And speaking from a person like my grandparents, I have both my grandparents lived out their days in a nursing home. And this was, almost 30 years ago, but I was so grateful because they needed that level of care. They needed that safe environment. There was nobody who could care, that their needs were so high that they needed that 24/7 care. And I was so relieved that they had that. Now, the misconceptions, I just feel like with the media, it's just always blasting. You see it, everybody sees it.
Right.
Like, look, this nursing home, this problem. They're not ever doing stories about the good care that nursing homes are provided. They're not doing stories on how dedicated the staff are. They're not showing the challenges and the burdens of why the care can be bad. And I'm not saying that it's not ever bad. I've seen it bad. I know it occurs, but we have to drill down to why the care is bad and fix that why, instead of just, saying they're all bad and, they're all horrible. We should shut them all down, because we do need that level of care. But there are some really big challenges. And, you kind of mentioned it earlier. It's like, in a sense, we need to, who's running these nursing homes? Where's the accountability? And is it just for making money, or are we really caring about what's going on? So we're not going to solve all the problems in a day. And even my book doesn't even cover all of the problems. I was more interested in getting it out to the public in a timely fashion than writing, taking the time. There's so much that I haven't even explored, like the financial side of it. I know that's a whole different ball game, but I just really, my plea to leadership, to the political leaders, are to really take a look at this. With our aging population, it's only growing. Let's fix the system. Let's invest in the people and make it a system that is going to provide the quality of care that is needed for this population.
Well, and I wanted to just kind of piggyback on that a little bit longer as far as the media and the public's perceptions and misperceptions in general. With COVID, we were hearing, it seemed like daily, multiple times a day, these horrible stories coming out of these nursing homes because of COVID and everything going on. And it almost seemed like, and it may not even be seemed like, it may have actually done this, where they already had this kind of stigma attached to them before COVID. Now it's like you're getting a double dose of it because of COVID. Now that we're, slowly kind of a little bit further away from the height of the pandemic, what do you think what do you think COVID has done to the long-term care industry as a whole? Where do you see it today versus maybe where it was at prior to COVID? Have you seen changes for the better? And I don't just mean in policies and practices, but also just in general, kind of stigma.
I would say right now, if there's one word that I could describe the long-term care industry, it's wounded. We're wounded. Our staff is wounded. We're just wounded. It's like we've been to war and we need to recover from that. And unfortunately, the process so much has been, let's add more survey, let's add more citations. It's still just coming at the industry with punitive measures. Right. And I'm telling you, good, strong people are leaving the industry every single day because they can't do it anymore. And they stuck it out during the pandemic because they knew that if they left, there would be nobody else. But now, I talk to people almost every day that they're so broken and they're like, I just can't take it anymore. And so I feel that the industry is just so wounded. And I go to buildings that, they may have a third of their beds empty because they don't have staff. And so these buildings so that's hurting the community. Right. Because then that backs up the hospitals. Because then if those people need emergency care, or, they need, if something happens, they end up going to the emergency room, or it backs up the hospitals, especially in the rural, smaller communities. And so it's devastating to see entire wings empty, just because they simply cannot get the staff to operate them. When I talk to the nurses, so I wish I had better news. I wish I wish I could say that, yes, it's better, but we're not. We're hurting. We're just very wounded. I just can't say more about that.
And that's kind of what my impression of it has been as well. And what I wonder, and maybe you have some insight or an opinion, how do they recover from this? How do they, increase their staff again and, regain some control over the situation, if you will? Because it does seem like they're dealing with their own pandemic now. And I don't see how they see their way out of it. Well, is there any light at the end of that?
Yeah, it really has to come from, unfortunately, it has to come from political bipartisan leadership in providing these nursing homes what they need. And I know there's been a lot going on this year or last year about that. But even some of the, funding has I feel like there's just always more cuts versus support, more punitive action with, we're going to invest at one point the administration wanted to invest 500 million into more survey and citations. I'm like, why can't we at least split that budget for more collaboration and support?
Right.
We have to show this industry, we have to show these people that we care. And that has to come from leadership. And I mean, I've talked to administrators that have mortgaged their houses. They're doing everything they possibly can to invest into the staff, that they're dedicated people that want to succeed, but we need the help. So this really does have to come from a leadership position in supporting this industry, or it may possibly collapse and we may not have it. I don't know. I mean, I'm not one to say things like that, sure. but it's a very fragile system right now.
It's very grim. Well, and I know this doesn't apply to us here in the States, but we had a guest on a few months ago, and they were in the care sector over in the UK, and they said, our biggest issue is the government there treated us like heroes during the height of COVID. Getting praise and, incentivized and all these different things. But as soon as things started improving, it was like we were forgotten about again. And they started treating us like, we were zeros. We went from hero to zero. And they said that demoralized all of our, our staff and our teams. And it's just, and I can kind of see some of that here as well. Do you agree with that?
So I want to take it a step further. Not only do I agree with that, but imagine in long-term care that you were not the heroes, that you were vilified during all of that, right. That you were the lowest level of priority for PPE, for testing, that we didn't have what we needed. And on top of that, there was $80 million funded to the survey process to come in and conduct a survey, infection control survey, in the height of their crisis. So when a nursing home had a COVID outbreak, surveyors came in. That's what triggered them to come in. So when they had half their staff gone because they were sick or they quit, they didn't have what they needed, they had surveyors coming in and finding fault with everything they did, which was so easy to do when you're in a crisis, right?
Right.
So not only did they not get it not only have they been a forgotten industry in general, but they were vilified even during the pandemic in their worst hour, and it's not even gotten better. So they started at a deficit and they just keep going lower, and so that's why I'm just like pleading with the industry leaders, with the political leaders, like we've got to start treating them like the healthcare professionals they are. Many times, and I was talking to CEO of an organization recently, he was telling me, they jump on CMS calls and it's just like automatically, it's like there's just this attitude of you're doing something wrong. And so we just have to shift that, like let's partner, let's reach our hand out. Let's help these people that are trying so hard to help our loved ones.
Well, Dr. Buffy, just to piggyback on that, why do you think that is? It's almost like there's already these preconceived notions. Like you mentioned, they get on a call, it's already kind of a villainous attitude towards the long-term care facilities. Do you have any insight into where that all started and originated from?
Well, I think that there has been a lot of corruption along the way.
Okay.
And I believe care has been, I think there has been less than quality care earlier even on. I mean, we used to, restrain the patients, or, high use of antipsychotic drugs. There's been really unethical practices, which really is what brought the regulations into place, which they needed to be. And again, I say we need regulations, but I feel like we've swung to such a polar opposite of, so now we're just assuming they're all bad and we're assuming they're not doing a good job. And we hear the stories of the families of the residents that have had horrible care or mistreated, or the staff that are mistreated. So there are bad things that happen. I mean, and I'm not going to deny that. And so I think that's what creates the reputation, is because there are really bad things that have happened. And again, I say, let's go back to why, what's going on behind the scenes. And instead of just slapping citations on it and thinking that's going to fix it, like, let's really dive in and work on fixing what's broken in it.
Absolutely. And I just want to kind of wrap this up with kind of your insight and tips to maybe, the healthcare industry, long-term care facilities, and our viewers and families. What would you want industry leaders to have learned from going through COVID at its height?
Well, I really want them to read my book because I want them to get a good understanding from the front line of what that felt like, what it meant. I want them, and to understand even what the punitive implications are and how that's affecting, and how we need collaboration. And I'm not saying there's no collaboration out there. Even CMS, they fund the QIOs, the quality improvement organizations, that's who I'm funded through, that I can come on site. We need more of that. We need more on-site, boots on the ground support. We need training. Oh my goodness, we need training. We need that infection preventionist on site, supported, trained. We need to be able to have the lower staff, or, better staff to patient ratios. And for families, you have a role in this as well. Get involved in your loved one's care. Get involved in the patient family councils, actively get involved. The last chapter of my book is all for the families. It describes Twyla Bridges' experience with her son and caring for him over 20 years in long-term care, and what she did to advocate. She got her senator involved to really make changes in this healthcare setting. So, how so much of what I say is we need government help, but as a people, we can do a lot too from the ground up. And we have to start using our voice for the good, and we have to start speaking about these things, because it is your voice that is going to help create the noise and hopefully to create change at the policy level.
Absolutely. And we will have the links to your book up on the website and on the screen here. And we just really appreciate the work you're doing. We have a deep passion for supporting our loved ones and our seniors, and for families to get the help and support that they need. And you've mentioned it, we have the baby boomer population. They're aging every day, and these facilities have to be equipped to support them, because if not, where are they going to get the care at if they're not getting it at home?
Right. Definitely need to continue to work on this.
I do want to mention real quick, you also are working on a second follow-up book to Broken.
Yes.
And hopefully one of these times the book's going to be called Fixed.
Is that what I need? I know that would be great. No,
that's the goal, right?
That's the goal. And the motivation, again, I continue to write because, I think after the book Broken, it's like, well, what do we do now? And we can't wait 10 or 20 years for the government to fix this. No. What can consumers do today? What options do they have? What can they look for? How to navigate it? And I'm really excited putting this together for the consumers. It's for me as well. I've got aging parents that are starting to age into needing this level of care. And, I think it's helpful that we all have some options and know kind of where to look for those best options.
Absolutely. And we will have the link also to your website, drbuffy.com, and the book is on there as well. But people can call you for consultation, and you do travel and can help people with their policies, their infection disease prevention protocols.
Right.
And, you're here to be a weapon and an instrument to help these facilities that will ultimately help these seniors and these people in the facilities.
Absolutely.
Well, Dr. Buffy, the author of the book Broken, thank you so much for all you're doing, and thank you for your time today and joining us here at All Home Care Matters.
Absolutely. Thanks for having me.
Thank you so much for joining us today here at All Home Care Matters. All Home Care Matters is here to help families as they navigate these long-term care issues. We invite you to visit us at allhomecarematters.com, where there's a private, secure, fillable form where you can give us feedback, show ideas, or if you have questions. Every form is read and responded to. And remember, you can listen to the show on any of your favorite podcast streaming platforms or watch the show on our official YouTube channel. Just make sure to hit that subscribe button so that you never miss an episode. We'd also like to say thank you again to Dr. Buffy, the author of the book, Broken. Thank you so much, and we look forward to seeing you next time here at All Home Care Matters.
Thank you for joining us today. We look forward to you joining us again on another episode of All Home Care Matters. To learn more about the show and to connect with us, visit us at allhomecarematters.com.